Hey everybody, Josh Kelly, Citadel Benefits Group. Happy Wednesday today, or whenever you're watching it, happy whatever day that is. Really excited to get this information out to you today about something that's been in the works for a little while, and it's finally come to fruition. And I'm really, really excited to introduce Katie Chili here. If you notice, the last name is the same as that other guy over there. It's actually Tony's daughter-in-law, which is super fun. But I want to kind of just set up this meeting here. We're going to kind of walk you through this new position. We're going to introduce you to Katie in a minute, and then kind of talk to you about what that looks like. Then we'll let David kind of explain why he did what he did and why this position is important. But basically, Katie is going to be the new preventative care specialist. And so what that means is her job is to make sure all the employees use the platform. That's the quick and dirty version of it, which is something that's going to benefit all of us. So before we dig into all of that, and I steal David's thunder, Katie, welcome. So excited to have you. If you would just give everybody a quick background, what your qualifications are, that it's not just Tony's daughter-in-law, what qualifies you for this?
Awesome. Thanks so much, Josh. So my name is Katie. I am a licensed clinical social worker. I have actually been working in the field for 10 years now. I have a background working with family members, individuals, groups, and kind of through all walks of life. Right now, I am very much focused on wellness. So I'm happy to be joining the team in that regard.
Awesome. Thanks so much. David,
Mhm.
would just give us a kind of what was your thought process as far as why this position was important to you, and kind of what you see this doing for Prodigy and obviously all of our employer groups.
Yeah, a long time ago in implementing this, one of the things that I always felt was missing was an introduction. There's an awful lot, which you will see, to this personal health dashboard. There's an awful lot to personalized predictive and preventative health that needs to be navigated. And so I always thought if I could get that right person out on the front at the point of implementation, immediately after enrollment, we'd see people going, oh my God, I can use this. And we'll close that gap that we have in people obtaining their compliance. But also, hopefully, we'll help people discover the depth of the platform and the benefit that we're really providing here as far as their own personalized health. And the benefit of having somebody that's a licensed clinical social worker means that the discussions with Katie qualify under Section 213D. Okay, for our platform, that's huge. The second piece to me is that we've got somebody who's educated in having hard discussions with people that they may not want to have. And if she can work with them and uncover that, hey, yeah, I'm stressed because I've got diabetes and it's running out of control, my doctor's mad at me and whatever. And in her way, as a clinician, be able to guide those people through the dashboard in a way that can help them, that's a win. That's somebody that's going to go back into work and tell a story that we all want to be told, right? Because that's going to improve enrollment. It's going to improve compliance. It's going to improve the way that we're seen in the marketplace. So this is really something that on the front end brings together the whole spirit of what the Paradigm program is. So I'll throw it back to you, Josh.
Yeah, no, and one of the things that we're hearing a lot of noise in the marketplace now. There's a lot more people offering SIMRP type programs. I'm not gonna call them SIMRPs because a lot of them are. I just don't. They look, feel, smell like it, but it's not necessarily like ours. One of the things that I tout and that I'm really proud of is I say, listen, we're offering the most compliant SIMRP program in the marketplace, and I truly, wholeheartedly believe that. Which I also think it's the best one. But I can 1,000. That's a little bit, I guess objective, because we could argue one way or the other. But we do have the most compliant one with the Prodigy program. So I'm excited to take this up just another notch. And so kind of the thoughts behind this, everyone, is, as we're doing the welcome calls and onboarding these groups, we're going to start introducing Katie into the mix and going ahead and scheduling some sessions right away with maybe some of the key people at the groups and stuff. Because if we get some champions at each business talking about it and they know who Katie is, we're going to add her into a page into the booklet we send them and everything. I just think this is going to be amazing because we all know the more they use the stuff, the longer they stay. And that's great too, from a sales standpoint. So Katie, if you would, can we just go through like I'm an employee and you kind of take me through like you would if I was an employee that reached out saying, hey, show me the dashboard. I want to do this. Can we do that?
Absolutely.
Cool.
So let me share my screen. Okay, can you guys see this?
We got it. We got it.
Okay. So what we're going to do really is to work through this dashboard, highlighting key aspects of it as a means of also making sure you're compliant, and then also how you can use it to your advantage. Like we've already mentioned, health and wellness is a big area, that there's always room for improvement, having those hard conversations and really figuring out, okay, how can I use this dashboard to my advantage? So when we meet, we're going to go over the dashboard, going over the components for you to be able to meet that 100-point requirement, and then also how you can use it to create and work towards your own personal wellness goals. At the end, after I walk you through the dashboard, we're going to discuss any additional service I can provide to you on a one-to-one basis, on an individualized basis, and answer any questions that you might have. So just to start, it's definitely important to start off by registering yourself and your family for the telemedicine services. A lot of the times we will get the question, hey, I'm trying to use telemedicine for my child, but I'm getting an error message. Why is this happening? It's because you need to register yourself first before you're able to register any dependents or a spouse. When you sign up, you're going to get a welcome message from US Health Centers, and that's going to have your login information for your personal dashboard. And then from there, I'm actually going to pop over to the dashboard right now, and I'll show you. This is what the dashboard is going to look like. You're going to go down to your benefits section, and then to sign up, you're going to click your virtual ER, and it's going to bring you to this flyer if it loads.
Hey, Katie, if you're showing the screen there, I don't think we can see it on our side.
Oh, I did change my screen.
We just see the PowerPoint.
Oh, I don't know how to fix that.
If you stop sharing and then just share your actual screen on your computer or just that window that you have popped up on the dashboard, that might be.
How's this?
There we go. We got it.
All right. Sorry about that.
All good. All good.
So let me backtrack a little bit. So I started at this dashboard. This is the home page of your dashboard. And I went over to the benefits section to the left. And then you're going to click your virtual ER. And it brings you to this flyer. It's showing up extremely zoomed in. So let me just zoom it out quick. And it brings you here. And you scroll and you're going to find this website and phone number. This is where you're going to sign up with your credentials. You can download the app. Then from there, once you're all set up, you go back to that benefits tab. Scroll down and then it's set up UCM access for dependent and spouse. Click there to begin. You're going to enter whether it's a child, your spouse, the information, and then click sign up. Then you should have easy access to the telemedicine services. Let me go back to the home screen. And then back to our PowerPoint. From there, so we're going to talk about your home screen. This is really where a lot of the information is going to fall. When you sign up, you're going to be encouraged to take this health risk assessment. Right from the start, taking that health risk assessment is going to get you 25 points towards that 100. So right there, you're already a quarter of the way done. It is lengthy. the first time you do take it, and we understand that there are going to be some questions you may not know the answer to. You can just click NA and then move on with the assessment. But also keeping in mind some of these items that you may be coming across as not knowing the answers to, maybe that can encourage you to have a conversation with your doctor or your provider. Give them a call and be like, hey, do we have this lab result? If the answer is no, maybe can we schedule an appointment for me to come in and discuss it? At the end of the assessment, these results are going to generate, and then when you log in a second time, your dashboard is going to look different, and I'm going to show you that in a second. It's going to generate your risk profile and resolution guidelines based on the information that you put into your health risk assessment. So let me bounce back quick to show you that. So this is, you can see this?
Yep.
Okay, making sure it's worked to go back and forth this time. So after completing the health risk assessment, you're going to scroll down, and this is that risk profile I was just talking about. So it is going to highlight past and present medical conditions, any pre-disease medical concerns, lifestyle-related risks. And then it's going to emphasize, are you at low risk for something? Are you at high risk, elevated risk? And you can also see here, it has the years. So if you do this annually, you're going to be able to compare your results year to year. And again, maybe even identify some areas for improvement or be like, hey, I did this well. You're going to scroll down a little bit further. And then this risk resolutions guideline section. So these are flagged conditions, essentially. You can click one of them, high risk level, and then it gives you a brief blurb about this condition. What are some of the risk factors? How can you prevent it from worsening? How can you change your diet, take some supplements? Will exercise help? And it really just gives you a brief little blurb about what you're looking at there. And the actual video is blocking the X here. Okay, sorry. Then you're going to scroll down, risk resolution, click there. So it's going to generate, sometimes it'll generate questions. I'm going to click start over here, questions about the specific condition. And then you're just going to pop through here. At the end, it's going to generate a result for you to look at. It'll generate a report, and then you can compare it and see the suggestions that it has for you at the end. And then
And if I may, Katie, the important thing with this and any one of the assessments is that don't panic. If you cannot answer any of the questions, that's fine. Take it to heart as a learning opportunity and a question to go back to your doctor and ask them and get that information. And then you can come back and get back on the dashboard and fill that out. This isn't meant to be a one-time use and done. It's meant to be a tool that grows with you.
Absolutely. Thank you, David. And then, so that's what your homepage is going to look like. From there, we're going to go over the assessments tab, and each assessment here is, again, you're going to get those points towards the 100 points. So 25 for completing the assessments. These will really help you be able to identify any areas of improvement that you may want to work on, certain components of wellness that maybe you may not have realized is something that you want to work on or would benefit from improving. There are several assessments under this tab. This is what it's going to look like over here. Your health risk assessment, which we just talked about. There's also assessments for diet and nutrition, your stress levels, your readiness to change, diet and exercise. So I'm referring to food frequency down here for diet. And it also has surveys for you to take about the organization's wellness programming, leaving feedback about the assessments that you're taking, and then also gauging, I'm going to pop back over to that dashboard for you, certain areas of interest and quality of life. So again, we're going to use the left as your navigation and click assessments. So what I was just talking about, so these are the screenshots that were just there, but this interest survey right here, it is going to populate. I'll just click start over again. Are you interested in learning about or improving upon these health topics? And then the more you click through, the topics are going to change. Again, probably a little bit lengthy, but at the end, it's worth it. So then you can identify areas for improvement, things I want to work on. And those are also some things based on the results of any of these assessments, whether it's interest, your health risk assessment, diet and exercise. Those are things we can talk about on that deeper level. Hey, like David said before, don't panic. Katie, I just noticed XYZ results. Can you walk me through this? We know it's challenging sometimes discovering something that we don't know may or may not be a problem. So having those conversations with me, listen, like, let's work on your mindset. We're happy to have this information now. What can we do now moving forward to make sure you're taking advantage of this dashboard and all these resources available to you while also improving upon your health? And then after the assessments, we're going to have the Road to Wellness tab. So over here, just reiterating again, every time you complete the assessments for the first time, you're getting those 25 points. Here is about diet and nutrition, fitness, smoking cessation, and stress management. After taking these assessments, again, really just reiterating the fact that you're going to gauge where you're at in your lifestyle, in your health and a wellness journey. You're going to learn about specific components, and then you can plan what course of action do I want to take. And that's also where I can step in. Katie, my health risk assessment said I would benefit from losing 20 pounds. How can we get there? And then we're going to go over and create goals together and then show you in the meantime, hey, use this resource on your dashboard to help you get there. And overall, just creating that awareness of what's going on. So the library, this is again talking about the resources available to you. The library has resources, it has videos. Each time you engage or participate in that, you're getting 5 points towards that compliance. So these points are adding up. It's going to help identify certain disease, prevention, treatment, and testing. So I want to walk you through that quickly. So we're going to go library again on the left side. At the top, you can filter it to everything available to you. You can filter it by videos with quizzes. You can even filter out the language. So over here, these are just some examples of things that are commonly searched or more frequently used. Right below under new, these are suggestions for you and videos that it acknowledges that you haven't watched. You can also use this search tab right here to make sure that, you know what, I know I want to look up anxiety. Let me type that in very quickly and they'll generate some resources for you. Down here, another thing that you can do is self-help, disease and medical conditions, a video library. You can click these and then it gets more specific as you click. So say I click self-help. Okay, what else? Mother. So I'm a new mom, actually. I have a 7-month-old now. So you click through mother and all this comes up. And I was looking through this and I actually thought to myself, hey, I wish I had access to this sooner, or I knew this even existed. So really making sure you're taking the time to look into the resources that are available that may apply to you. So let's just say discomfort of pregnancy. I learned that as I went. But here, maybe I could have known what I was getting into or prepared better, planned better, and used this to really help there. So again, there's plenty available to you in the library. Click around, play with it, use that search bar, and then again, have those conversations with me, Katie. I can't find what I'm looking for. Do you know if this exists in that library? And we can absolutely go ahead and discuss that together. Then after the library, you also have this health counts tab. This is where you will go to kind of keep track of your points and see where you're at. It's going to let you know how many 1-point activities you've completed, how many 5-point activities you have completed, how many 25-point activities you have completed. I also just want to make a note. You get 25 points for recording any initial visits with your provider. So the first time you go and see your PCP, you record that, you get 25 points. The first time you see your dentist, you record that, you get 25 points. After that, any follow-up visits you have, the first 2 follow-ups, you're going to get an additional 5 points for logging those visits. I'm going to quickly just show you that page and show you some drop downs over there quick. So again, the toolbar on the left side, right here under active campaigns, quick overview, 1 of 11 1-point activities completed. You click this arrow, 52 of 132 5-point activities completed, and so on and so forth, 2 of 15 25-point activities. Down here, you can click, a drop down of 1 point activities. Make it smaller. Same thing with 5. Same thing with 25. You also can over here, it's not a requirement, but under uploads, if you want to keep documents in the same place and have access to everything, kind of using your dashboard as this one-stop shop, add, view, upload files, you can do that right here. And then from your health counts page, we're going to have the health tracker section. And this is something that you and I can, on an individual basis, really hone in on. If you and I create a plan for your goals, you can track your activity, you can track medical data, you can track your diet, sleep, self-care activities. You get 5 points for connecting a fitness device if you use a Fitbit, Garmin, Apple Watch, any of that. But while you and I are meeting to go over your goals, we can say, hey, I want to take 10,000 steps a day and add that to the exercise model. You can say, Katie, I want to make sure I'm drinking at least 100 ounces of water a day. You can add that here. Again, with the medical testing results, you can log. And this diet, exercise, sleep, self-care, all activities we identify together, you can put here. I'm going to show you that live really quick just to really hone in on what we're talking about. So you're looking at exercise, you're going to click right here, log activity, the date, what kind of activity it is. Again, if exercise is one of your identified goals, how long you did it, what you did, you save. You can also create a favorite activity. So you know I'm going to be working on specific things. They'll be easily accessible to you there. While you're looking through these charts, again, same thing with water, you can click right here, chart options, and filter it out. I want to look to see what I did on March 13th. And then same thing up here. And you can also filter for activity, filtering it by activity. Hey, when was the last time I did aerobics? And then same thing along the same lines of logging your nutrition, filtering start and end dates, how many hours of sleep. Say, Katie, I really want to prioritize my sleep and start sleeping at least 7 or 8 hours a night. We can keep track of that here. So then self-care tracking, Katie, I want to get up and meditate every morning. I want to make sure I'm taking time to journal. We can identify those activities, log them here. And then as you're working on your wellness goals, you're able to be like, hey, I noticed this trend is trending down. I'm not hitting this goal as much as I used to, or vice versa. I'm having an easy time doing it. Maybe let's ramp that up a little bit. Let me try and push myself a little bit further. So again, really just keeping track of what you want to work on, how we're going to better your health and wellness, and staying in touch with me along the way. Just quickly, I also want to touch on your benefits and healthy mall tab. So benefits over here is where you're going to see all of your benefits in one place. You can click cost comparison, and I'm actually going to come back to this one. But even over here, addiction recovery. And as I'm saying this, I really want to remind you as well, no one can see what you're clicking through here. All of this is HIPAA compliant. It's a HIPAA compliant platform. So all of this is personal to you, unique to you, and so feel free to click through whichever you need to. So say you click here, you're going to see this flyer for addiction recovery help, phone number, and email address. Just going back a little bit. Same thing for coaching and advocacy. This is where your virtual ER was, where you sign up for your telehealth services that we talked about to start. If you need to use EAP, prescription discounts, where you set up your dependents and spouse. But really quick, this is something that I think everyone should be familiar with, the cost comparison of any services. So you're going to go here and type in quick. Okay, that pre-populated where I am, so that is convenient. And then you click what procedure you're looking to see what kind of cost you're facing. So I'm just going to click through quick here. And then you hit submit. And then over here, a great price for this procedure in Greenville, South Carolina, a fair price and something expensive. So when you know and you're being told, hey, you may want to consider this procedure, take a look at what is out there cost-wise so you can do what's best for you. Again, it'll list over here specific facilities where you can find it, the price range at that facility. Just something quick to keep in mind as you're accessing your medical services. Then last but not least, last tab on the page, some of your products and things that you have access to that are going to support your well-being, things that are offered at lower price than what you may find on public websites. So travel rewards, you got a health risk screening over here. So what that actually is basically like a home, I'll show you for a second. So home lab kit. And then you purchase it, you bring it to your doctor and be like, hey, can we schedule this and get all this testing done? The cost comparison that I just showed you, couple-wise, is counseling services for couples, the discounted prescriptions. So this is your dashboard. All is said and done. So what can I do to help you with your dashboard? You need to use it. So how are we going to take advantage of it? Through the assessments, through walking through each tab that's there to you, you're going to be able to identify your own unique wellness goals. And wellness is different for everyone. So whether it's something physical, emotional, spiritual, you want to work on stress management, develop sustainable habits, anything along those lines, these assessments are going to help you. But then also conversation either about those results or just generally speaking, like, Katie, I noticed my energy is low. Do you have any suggestions on what I can do? How can I increase my energy levels? Is there something you can guide me with, a suggestion that you can give me? With whatever identified goals you and I come up with together, we can create a personalized wellness plan. So creating goals to fit what you identified wellness to mean to you, but also creating goals that fit what some of these assessments may say you would benefit from working on. And sometimes we think, oh, I'm just going to lose 50 pounds. That's no problem. Or I'm going to monitor my blood sugar. I'm going to keep it low. But it's important to really identify, how are you going to do that? What is it going to take for you to lose those 50 pounds? It's saying I want to lose 50 pounds is just very general. So we really want to dial in, hone in on. Maybe we're going to focus on 5 pounds at a time and really make them small, sustainable goals to reach that one big goal and goal at the end of the day. Like I mentioned earlier, a lot of this comes with addressing your mindset. Some of this may be difficult, it may be challenging. You may not see the results that you want. You may be upset or discouraged by a certain diagnosis. That's where I come in. I can really have those deep, intimate conversations with you about what you're feeling emotionally and really walk you through and encourage you to do everything in your power to make these healthy lifestyle changes. At the end of the day, I'm here to provide you support and education and be with you every step of the way on your journey. And then, any questions? I am all ears. And that is your personal dashboard. Okay. Josh, I think you're talking, but you're muted.
Technology, sorry. Obviously there's a lot of stuff inside the dashboard.
Yes.
It's really easy for someone to get overwhelmed when they log in because there's a lot of different things to do, which is, she stressed obviously beginning, take the assessment so it kind of tells you where to go, but sometimes we just need a track to run on. I know that's why I'm not currently using a personal trainer, but when I was, hey, tell me what to do, because it's really easy for me to get there and start talking to somebody at the water cooler, and then next thing I know, I'm just going to eat breakfast, right? So when I go to a gym, but it's really awesome to have somebody to kind of point them in the direction. And obviously, each conversation is going to be different. She went through kind of a high level of everything in there, but when it's one-on-one and you're actually interacting with somebody, there's going to be some specific things that get pulled out and shown, just certain things like, hey, if she finds out they're diabetic, for example, well, she's going to hone in on this, and this. She's going to say, hey, they're super stressed. Here's this. And it's going to open up other conversations. And I just think this is going to be just completely next level, that it's going to raise everything up to. And one is it's going to make us more compliant. One is it's going to help us keep groups longer, but we're going to get employees healthier, which is awesome. That's really what this is all for. At the end of the day, Prodigy is a health and wellness company. You know, yes, it's sexy to help us sell a lot of insurance products, right? That's fun. It's great because it's helping the company save money, but we're getting people healthier, which makes them happier, which affects everybody around them. So I'm really excited about this. I'm excited about the addition of Katie to the team there, and we're going to start integrating it in. So just know you got Katie now. You know, you got her for you need help with the dashboard. You're having a conversation with somebody and you're not really sure what to say or maybe not comfortable saying. That's her job is to have uncomfortable conversations with people and let them talk through things. I mean, that's literally what she does. So use the resource. It's going to be amazing. So that's all I've got. Uh, Tony, David, any final thoughts?
Yeah, just simply, this is really about our participants and helping them find their way in something that's incredibly overwhelming. And that is the health marketplace. Where do I begin? Where do I start? Well, you begin and start with yourself. And having somebody like Katie in there to help them find their way through everything that we provide and then make use of where it's appropriate. Our nurses and our dietitians and our nutritionists and all that within this model is extremely empowering. And again, those of you that know me, you've heard me say this. We are validated to be 25 to 30% increase in positive outcomes with our participants, which means that we decrease healthcare costs over time as well. This is going to make a huge impact in achieving those goals.
Love it. Love it. Tony, any parting wisdom?
No, just that, this doesn't cost anybody anything, right? It doesn't cost the groups. It doesn't cost the brokers. Katie is a Prodigy employee, so we're giving you this resource and take advantage of it because your groups are going to have a better experience. Why is David doing this? I know he outlined a bunch of reasons. Selfishly, we think this will impact retention because employees are not just going to be checking boxes to get to their 100 points. They're actually going to be engaging with these tools. Every time I watch her run through this, that I've seen a couple times now, I actually see something in there that I didn't know was there. And if you noticed, that's actually the refresh skin of the U.S. Health Center dashboard. So I think it's laid out in a better fashion. The color scheme is more pleasing to the eye. Right now, both of those websites are working, those web addresses, and both tabulating points. But wherever possible, you want to get your groups to use the new site because eventually I'm sure they will sunset the old ones. We sent that web address to every one of your groups with the most recent compliance reports, which was mid-March. So the group contacts do have that information on the redesigned quick guide. If any of you guys, still need that for anybody in particular, you know where to reach me. Feel free, and we'll get that in your hands.
Awesome. Awesome.
And one last thing I want to say is with the depth and weight that we provide to your client groups, particularly your participating employees, this gives you a really good reason to have regular touches in all your groups, which means you're going to find people that are new that you should enroll. You'll make money on that. But more importantly, increase the satisfaction of yourself as a broker versus being just a salesperson. Develop the personal relationships. They'll stick. Develop yourself as that solution provider. Joe Blow's been in the program for 6 months. He doesn't have any points. Oh, well, I know, Joe. I'll go talk to him if you don't mind. Have a 5-minute conversation. What's wrong? Oh, that 100 points. I don't know if I want to do this. Have you talked to Katie? No. Let me hook you up with Katie. Have a 10-minute call with Katie. Use it to your advantage. Use it to have those additional touch points that make you an indispensable resource to your groups. This is a huge opportunity to do that. And you'll write more business because of it.
Great. Agreed. Well, awesome. Well, everybody, as you know, if you need anything, reach out to us. Thanks for the time you took to watch this. If you have any questions, reach out and we'll get those answered. And along with this video here, obviously in the email that you received has all the information on how to get in touch with Katie and everything there. But thank you all so much. We appreciate you. We appreciate your partnership in everything we do at Citadel and at Prodigy. And let's continue to make 2025 a record year. Have an awesome day.